Coronary Angiography. Introduction. Sometimes people have serious problems with their heart and the arteries that go into it. An angiogram helps doctors look at blood vessels of the heart. If your doctor recommends a coronary angiogram, the decision whether or not to have the procedure is also yours. This patient education module will help you understand better the benefits and risks of this procedure. Symptoms and their causes. Cholesterol deposits accumulate in the coronary arteries, forming a plaque that narrows the artery. Narrowed arteries do not let enough blood go through. This causes blood flow to decrease, which could cause heart attacks. This is the cross-section of a normal blood vessel. This is the cross-section of a normal blood vessel, and this is a cross-section of a blood vessel clogged with plaque. If blood flow is reduced enough by cholesterol deposits, the heart will not be able to keep up with exertion. If the condition worsens or the coronary artery becomes blocked, the heart can be damaged. An angiogram is a test that helps show the plaque in the coronary arteries and helps detect any narrowing or blockage. Other tests, such as EKGs or heart tracings, can cause the doctor to suspect blockage in the coronary arteries. However, these tests do not show the blood vessels. A coronary angiogram is the only reliable test that shows the blood vessels of the heart. Procedure. Your healthcare provider may ask you not to eat or drink for several hours before the procedure. If your surgery is in the morning, this usually means no food or drink after midnight the night before. During an angiogram, the doctor inspects the coronary arteries for blockage. The angiogram may be done on an outpatient basis, meaning you will be able to go home after the test is completed. This procedure is done while you are awake. There is virtually no pain involved. You will be asked to lie down on an X-ray table. During the procedure, the heart rate, blood pressure, and vital signs are continuously monitored. The groin area is then disinfected and made numb with a local anesthetic. A catheter is then inserted into the artery through the skin in the leg and threaded all the way up to the coronary arteries. Sometimes, depending on the doctor's preference and the state of your arteries, the catheter may be inserted in a big artery in the underarm or the upper arm instead of the groin. Dye is then injected in the arteries and X-rays are taken. You should stay very still during the X-rays to allow good, sharp pictures to be taken. If a blockage is found, the doctor will recommend whether it can be opened using either a balloon or another device. The procedure that uses the balloon is called angioplasty. Your doctor will discuss with you after the angiogram is completed if you need angioplasty. After the angiogram and the angioplasty, if it is needed, the catheter is taken out. In order to prevent bleeding from the puncture site, you will be instructed to lie flat and not bend your leg. If your cardiologist uses a closure device, you will lie flat for about 1 hour. If not, you will lie flat for up to 8 hours. You should not bend the leg on the side of the groin that was catheterized. You will probably not be able to drive and will therefore probably need somebody to drive you back home. Risks and complications.